Facial fillers are commonly used today as well as in our practice, and a lot of patients come in with deeper folds or depressions that they would like filled. It picks up where Botox leaves off. Botox works in a totally different way. So what we're trying to do with these fillers, whether it's Juvederm or Radiesse, and they're different substances, they fill in the deeper creases that cannot be really addressed with any resurfacing or chemical peels or anything like that. They typically are a syringe off the shelf, and you can inject them in the office under some surface numbing medicine. They're pretty well tolerated. The areas that we typically do are these deeper folds here in the nasolabial folds, the lines coming down from the corners of the mouth. Some people prefer fuller lips, and we can do that with injections across there. And even this area called the tear trough, which is this crease that's underneath the skin, if you can't address it that well with surgery or don't need to or don't want to, you can actually put a filler in there which will help smooth that out. The only caution I have about this one is it tends to bleed a lot more and bruise worse, so you have to be careful about that. A lot of patients come in and want a shorter recovery period, and these fillers are ideal for that because there's really very little downtime. There may be some temporary bruising and maybe some temporary swelling, but usually the bruising may be gone within a week or so, if that occurs at all. And the swelling is usually gone within about 3 days. So the recovery period is very brief for this. You can do it on a Friday and go back to work on a Monday without people really knowing too much. It can be a subtle change, but it makes a big difference in how you appear without having to do surgery.